Hello, RDs and RDs to be. Welcome to the RD Exam Ready podcast. I'm Zach Caseberg, your tutor, coach, and guide along the path to passing the RD exam. My biggest passion is to help RDs and RDs to be just like you to know more about how to pass the CDR exam. If that sounds like you, then hey, you are in the right place. Thank you to all the recent listeners who joined us for our recent RD Exam Ready Live that was hosted on YouTube, and we just did a session on YouTube last week that was only practice question focused. We practiced questions from all 4 domains, we added calculations in there, and I really tried to give my participants a good breakdown of using the process of elimination and finding that best answer. If you didn't get a chance to join it, remember you can always go back and watch those sessions for free on the RD Exam Ready YouTube page. Just go to that live section and you can go watch all those previous lives that we've done before. Our most recent one was practice questions, but we've done work on enteral, total parenteral nutrition, we've done food service calculations, and everything in between. So make sure you go back and watch those just to get a little bit more free content. I'm looking to do those about every other Wednesday, so if you are interested in joining that, make sure you subscribe to that channel, hit notify me if we're going to go live soon, or just keep a lookout on the RD Exam Ready Instagram page for upcoming announcements. The topics that I really notice that my students gravitate towards are things that are clinical focus, food science, management focus, but we don't want to discount some of that information that we need to know in Domain 4. I've had students before tell me that they've struggled with questions that are related to menus and menu development. In my current role working as a food service dietitian, we talk about menus all day, all the time, and sometimes menus can feel very straightforward and sometimes they can be a little bit confusing when we apply it to questions. So really, if you haven't taken a class on food service in a while, you might be a little limited on your knowledge of food service. I thought it'd be great to take a session today to talk about menus, talk about menu development, give you the background of what you should need to know for exam day. So don't discount Domain 4. Come listen in. Let's get a little bit more information about menus and the practice questions associated with it. The thing to remember about a menu is that much of the time, a food service operation is going to start at the menu level. The menu would establish the inputs that would be needed for your food service system, and even a small change to a menu can impact the whole system as a whole. We know that a menu is obviously, it's just a list of food items being served, but it is much more than that. The menu would determine things like the personality of your operation, whether it's upscale, mid-scale, low scale. The menu would impact the layout of your food service system, the equipment you need, the skill of your staff and how much staff you're going to need, even your flatware, dishware, glasses. Everything is all being centered around the menu itself. Now, let's get serious about what we're going to see in menus. In hospitals, menus are typically provided to a hospital patient, sometimes to an employee, or sometimes it's just a written menu that's being provided. If you've ever worked in a diet office or done an observation there, you know that sometimes a menu is being actually spoken to a customer, not even reviewed physically. So maybe they don't have the ability to read the menu or they can't see it. So we would call it a spoken menu if someone is reading a menu out to you. A lot of hospitals have now taken to the food service model that was made very popular by hotels, where the patient can call down to the diet office when they're hungry. Their order can be delivered maybe within 30 to 45 minutes. In the restaurant area, menus are offered in many different ways. Some chain menus are doing them more on that digital format, but we obviously more upscale, see higher scale restaurants that do more of a written or a physical menu that you can see, observe. And then some operations are like grab and go, where you circle a menu item, give a ticket, and then walk out with it. When you're writing a physical menu, you have to consider many different elements of a printed menu specifically. The menu should present an accurate idea of the food service operation and what it provides. You can orient things on the menu to even highlight certain items to push customers towards certain menu items, and we call this menu psychology, your design, your layout of a menu to try and influence the sales of a food item. Elements of menu psychology may consider something like eye gaze motion, which is where the eye travels when you open a menu. Let's say you have like a trifold menu, a threefold menu, and you open it up. What's the first thing you look at? Typically, it's right there in the middle. So when you're using menu psychology, you're trying to orient menu items, or maybe the things you want to highlight, like those prime items, right there in the middle. You may want to place menu items as the first or the last of something because, again, your eye kind of gravitates towards those first or last menu items just based on how we normally read things in the list. For menu psychology, font size and style are also things we have to consider, and we do this all the time, right? Menu items are going to help be drawn toward it, so just like anything, you want to make sure you use a font and font style that's easy to read for customers and avoid anything like detailed cursive, big bubbly letters, because it's just difficult for some people to read. Color, brightness. These are other ways that I can highlight certain elements on a menu by using colorful shading to help really draw the customer's eyes towards that menu item and information. Of course, spacing and grouping of items really helps to organize the menu, and us type A personalities, well, I don't know if that's me, but for type A personalities, we like things nice and organized so we can see what our options are going to be, right? We're going to have a couple menu terms that I need you to be familiar with, and I know that many RDs-to-be have already heard these terms before, but let's outline them just to be quite sure of what they are. Starting with prix, or prix, as it may also be known. I'm always terrible at pronouncing words in French, so you'll have to excuse me. When an item is served as prix fixe, as I read it, this means it's served at a fixed price. Prix fixe means fixed price. So this always means fixed price for a single menu. We can also expand this, though, into a table d'hôte. Table d'hôte is another term to be familiar with, which is a French term for the host's table. And in a table d'hôte, several food items are grouped together and sold as one price. So you may see this when you go out for a special event, Valentine's dinner with a friend or significant other. You may see this at a lot of fine dining establishments. The largest difference between these two is that in a prix fixe, what you're seeing is just the whole menu priced as the menu, whereas a table d'hôte allows you to make more selections. So you're still paying the single price for the menu, but perhaps maybe you're going to choose your entree or your side or your dessert. Those would be the different stipulations you would see in a table d'hôte where you do get some ability to choose what you want. So prix fixe and table d'hôte aren't all that different. Table d'hôte always has a fixed price usually, but you can make some certain selections on options. Now this is dramatically different than an a la carte menu. A la carte is something that we're usually pretty familiar with, but let's outline it to be clear. An a la carte menu means every item is going to be priced individually instead of a total price for the full menu. We commonly see this in chains, grab-and-go areas, retail facilities where you're going to put an individual price for every menu item served, and you can choose what you want. The item d'hôte is going to be another term that I want to add in here. Excuse me, not item d'hôte, the item du jour, pardon me. Item du jour is what we would call our special of the day. So your special of the day, your item du jour, could be a specialty soup that you're offering. My favorite example is I used to like the cartoon Bob's Burgers, right? And every day at Bob's Burgers, he does a different burger of the day. That is Bob's item du jour, his specialty burger that he is offering that day to try to drive some customer interest. With menus themselves, there's going to be 3 types of menus that you need to know about. Static menus, cycle menus, and single-use type of menus. You could have a static menu. A static menu is where you're offering the same menu items every single day. Traditionally, static menus are used at restaurants, but sometimes hospitals and other types of facilities too. What's really nice about a static menu is you know how these items are going to be prepared consistently. You're probably able to source those items a lot easier. And you're better able to choose the equipment you need because you know it's going to be the same equipment that you need each day. Static menus tend to be a good choice for a commercial food service operation, such as an upscale restaurant, limited menu operations, coffee shops. These would all be great places for a static menu because you're not going to vary the menu tremendously each day to day. So you're going to offer the same static menu most of the time and be known for those food items. Our second type is going to be the cycle menu. And cycle menus are a series of menus that rotate on a weekly, bi-weekly, sometimes monthly basis where the cycle is repeated. Where I work, a lot of the times we do a 4-week cycle menu, where week 1 of the menu is going to repeat every 4 weeks or so. So we don't offer the same thing every week, but on a monthly cycle, it's going to change through there. Cycle menus are a great fit for a non-commercial operation, like schools, universities, and hospitals. They're even seen in some healthcare institutions because what they do is they offer you some degree over the purchasing, production, and costs. But as you can imagine, in comparison to a static menu, a cycle menu is really great for offering variety to folks so that they don't get bored with stuff. And variety is a great thing that cycle menus allow us to do. Thirdly is our single-use menus, and this is the least common. Single-use menus play a particular role for just being used at one time. So this will be better for specific events. A Thanksgiving buffet, a wedding, a bar mitzvah. These are going to be great for specific menus that are going to be used for one event and one event only. When a food service operation is forming a menu, there is many factors they have to consider here with menu planning. I don't need you to know every factor, but I need you to kind of wrap your brain around what we're thinking of when we're doing menu planning. So let's go through each of these. It's going to be a bit of a long list here, but I think we can handle it. Starts with customer satisfaction, right? Customer satisfaction is one of those key factors we would consider. To remember also that customer satisfaction is an output of a food service system. So keep that in mind when you are serving your customers, is that that's going to be an output, very important, to make sure you're meeting their nutritional needs, giving them food that they like, giving them food that's appealing, and considering the culture around you. As we talk about culture and demographics, these have to be considered when you're planning your menus out. Sociocultural factors such as customs, norms, demographics, these are all considered when you're planning a menu. If you're serving an elderly population in a long-term care facility, your menu offers should be centered around foods they are familiar with traditionally, such as, in my area, very traditional home-style offerings, casseroles, meatloafs, combination foods. Whereas if I'm working in a school where I have younger populations, I may need to include new trends, new foods, because they're going to be much more likely to try new things than maybe an elderly population would. I want to stay on this just for a minute as we're looking at it. We're seeing more trends in vegan and vegetarianism, dietary preferences here. Your population of customers that value these types of options will dictate the variety and number of offerings you even have. Some places just have one vegan offering and some places have several, right? Sustainability also factors into this too. Your younger customers, if you're serving them, are going to be much more focused on having sustainable options where they come from. Things like seasonality and things like local produce are all things you would have to consider if your customers value it. For culture and religion, these factor in greatly when you're putting a menu together and choosing entrees. If you're having a heavily Indian customer base, you'd consider the type of rice served, the spice level, the number of vegetarian offerings served. Or even with religion, if you have a large Muslim or Jewish population, you're obviously going to decrease the amount of pork offerings you have on your menu, and maybe even whether you offer alcohol or not. So these are all different demographics and sociocultural norms that have to be considered when you're forming a menu. The other piece I would add here too is nutritional adequacy. Depending on your operation, you may have to have menus offered that consider the health status of customers. For instance, in the hospital, you're considering a cardiac or renal diet being offered to patients. This factor would have to be included in menu planning to ensure you're meeting their dietary needs and keeping them satisfied. You wouldn't want to only offer low sodium vegan options just because you have a cardiac diet, because your customers would feel very limited by that, right? We see this even more now with different dietary needs for food allergies and sensitivities too. More and more operations are trying to accommodate these people that have this dietary need. Such as you might see an operation put a little peanut symbol next to dessert items that contain peanuts. Or you'll have a little asterisk that says gluten-free bread is available as a substitute. So you're seeing this a lot more where we're trying to accommodate these individuals. And if you can't accommodate them, you are going to limit the amount of people that you can serve. When we were talking about nutritional adequacy of meals, we also want to include a bit of government regulations here, if you can believe it, because this will influence menu planning. You now have higher trends of customers who want healthier food options. They want meals that are nutritionally complete, and they may even consider foods that have fiber, phytonutrients, lack of carcinogens, or even artificial dyes as things that they would use to influence their food choices. Specific to those government regulations, to make you think here, this can be tied to the type of food service operation you're running. If, let's say you are having to adhere to government regulations, you would have to plan your menus around that. We see this a lot with the National School Lunch Program as an example. In my job, we serve several schools around our campus that adhere to NSLP guidelines, and we have to make sure we stick with those when we plan their menus out. If you just listened to my recent episode just about food assistance program, you probably know what I'm talking about here. For the NSLP, as that example, we have to make sure we meet 1/3 of the daily value for many nutrients, calories, and protein. And so as someone is forming a menu for those lunch programs, they would have to consider that, or else they're probably not going to get the government kickbacks that they need there. Even such things such as types of fruits and vegetables offered, number of whole grains offered, dairy offered, these are all things that would have to be considered in menu planning with government regulations. Even Medicare, Medicaid-funded programs such as Meals on Wheels or congregate meal programs have different stipulations as far as what government will reimburse programs for, and so that would have to be considered as well. Now to sustainability a bit as a factor to consider. We know populations are becoming more concerned about sustainability in their food service system. We need to consider that with menu planning as well. Locally grown foods, using in-season products, sustainable seafood, limiting the use of processed food items, and using vegan and vegetarian entrees in place of some of those meat ones are all ways that we meet people at their sustainability wants. Different food service groups will partner with different farms in their area. They may grow their own produce and highlight different food items using this. I see this in my job all the time. Whenever we can use locally grown produce or maybe like a freight farm type of system where we're growing herbs, we really highlight that, and it does make your customer base gravitate closer to those items because they say, hey, it's local, it's sustainable, I want to see what it tastes like and I want to consume it. Now with aesthetics of a menu and aesthetics of the items you choose on a menu is really just how it all looks. I know that students will sometimes get questions about aesthetics, so let's make sure we talk about these aesthetic factors of menus. Things like flavor, texture, color, shape, method of preparation. Those are all things you would consider when you're planning a menu. I'm not going to spend too much time outlining each one of these factors because, again, I do feel it's self-explanatory, but I want to spend a little time talking about flavor and balance of flavors. Obviously, something you would want to consider in your menus would be to make sure you're not offering too much of one flavor. You want to have some things that are umami, some things that are savory, some things that are sweet or tart, so that you're pairing up menu items in a way that gives balance amongst those flavors. You also wouldn't combine foods that don't work together or are super awkward, right? Like, I don't know, if you did a tart smoothie bowl and then offered cranberry sauce as a side, those are kind of weird offers a little bit. Texture has to be considered in menus additionally. Let's face it, when someone is in a hospital and they're on a pureed diet, all the pureed items are the same texture, and they hate those menus. They are not satisfied with them because they lack difference in texture. So that's why on menus, when you can, you want to consider having foods that are crunchy, chewy, snappy. You want to have those types of things in there to give them a wide variety of textures. Color on the plate, oh boy, working with kiddos and stuff, I can certainly tell you that color is a factor when it comes to menu planning. So I'll give you a menu here and you tell me what you think about the colors here. Let's do fried chicken, mashed potatoes, a wheat dinner roll, and a cheesecake. What do you notice about that meal? Well, it's pretty brown and it's pretty white. So that would be an example of poor use of color on a menu. A better idea would be to throw a green vegetable in there like a green bean, cornbread instead of the roll, and maybe choosing a dessert that has fruits or berries in it to provide some more coloring and be more appealing to the customer. Shape is another element here too. I'm going to give you another menu and you let me know what you think of it. Let's do a menu that has grape tomatoes, meatballs, and gnocchi. And then let's throw some blueberries on there too. What do you notice about all these foods? Well, you probably notice that they're all round, right? So you don't want to offer foods that are all the same type of shape. You want to differentiate them in different shapes, textures, colors to make everything more appealing. Now that we've exhausted this aesthetics a little bit, let's continue going on about different ideas here. In a food service operation, you have to make different management decisions about menu design, what to keep, and always consider things like food cost, product capability, type of service, and even the availability of the types of foods offered. When you're considering the food cost of items, you're really looping in the thought of your food cost percentage and even the selling price you might use for a food item. You would consider things like the raw food cost and even the prepared food cost of a menu item. Let's elaborate here a little more. Let's say we have a retail space that offers some convenient things like chips and beverages and maybe some frozen microwave dinners. And then let's say we also do personalized pizzas here too. For those personalized pizzas, it's going to take a lot more labor cost into consideration of pricing those items because you're paying a staff member to prepare the pizzas, bake them, cut them, and customize them. They also have to work with the equipment too. Whereas let's take a look at those frozen microwave meals in there. Now, a meal like that is a pretty high food cost in general, but the thing is your labor cost is very low because really you're just wringing them out and then giving it to them to heat up. So for a food item like that, you're not going to have the food cost percentage be so high on that. You're not going to have the selling price be so high because all you're doing is largely checking the item out and giving it to them. Secondly, your production capability is something you would consider with menus. Labor will be your primary concern when it comes to production capability. You would consider the number of labor hours you have to prepare the food as well as the skill of the personnel that is doing it. If you're working in a food service operation that's quick service type of operation, maybe a grab and go type of operation, then the level of skill of your labor force needs to be pretty low. It's not going to be that high in that case. Whereas in a fine dining place where you're doing specialty steaks, seafood, foie gras, really specific broths, you're going to need some very high level of skill level in your labor force compared to that quick service operation. As you're offering menus, it also consider the equipment that you have available to you. So you have to consider things like your oven, steamers, fryers, grill, which things you're going to have access to during the meal period, even things like refrigeration, freezing capability would all be included there. Let's add an example for some context here. I would apply this to sometimes what I do at home when I do a lot of cooking. So if I am a poor menu planning, let's say I put this menu together. Oven roasted potatoes, oven roasted asparagus, and oven roasted chicken. Well, what are you noticing there? I'm using the oven a whole lot there. And this is a bad idea of menu planning because Each of these menu items is going to require a different temperature. They may require different types of cooking process. And so if I'm using the oven for all of these, this is poor menu planning because now all of my ovens are taken up. A better idea maybe would be to do grilled chicken, roasted potatoes, and steamed asparagus if I have those things available so that I can kind of spread out the use of my equipment and not tax just one oven because then I'm so limited into what else can be cooked in that oven there. The type of operation is largely a major influence on the type of menu. Depending on the type of operation, you have to consider things like how long a food is going to be held, if it's going to be transported, how quickly a customer is going to consume it after it's cooked. With this, you obviously then consider the equipment you're using to hold and serve those food items to make sure you have sufficient capability to keep those food items safe and high quality when they get to the customer. Now, when you have menu items, we're also choosing whether to keep, remove, whatever we want to do with the menu items. So you've likely heard of this menu planning concept of the plow horse, the puzzle, the dog, and the star. I feel like I'm reading a children's book here. A plow horse or a horse is an item on your menu that is very, very popular, yet low profitability. I usually think of steaks or seafood as a good plow horse because they're highly popular items, people love them, but the problem is they are very expensive. They have a very high food cost to them. If you want to improve a plow horse for your operation, what you could do is you could increase the selling price of that item to help with profitability, or you could decrease the portion size to decrease your food cost, therefore helping your profitability. A star is both profitable and popular, and this is easy. Don't do anything with a star. Leave it. Do not modify it on your menu. Stars are good. We need to leave them on the menu. A puzzle is an item that is profitable, yet it's not very popular. A puzzle is something we have to figure out. Let's say a tofu stir fry, right? Tofu stir fry is generally, it's a profitable item, but maybe it's not going to be the most popular on your menu compared to your other offerings. So maybe you consider other offerings and using this item as an item du jour, a specialty item, or maybe you'll reduce or modify the price in order to drive more customer sales to it. Lastly is the dog, which I take personally here as I love dogs. A dog is not profitable nor popular. Usually the example we have here is you have a little old lady who comes into your food service operation and every week she orders, let's say, the liverwurst. Okay, the liver, that's what she likes to eat. But she's the only one who comes in every week to get it. It's not popular and it's not profitable at all because we don't sell it very much. So in this case, sorry little old lady, but the dog we have to get rid of. That's what you should do in your operation is get rid of the dog and eliminate it off of your menu. With menu planning, I just want to give you the background of the step-by-step process of how to form a menu. I don't think you're going to need to know a ton of questions on this. I don't think that's going to happen, but one thing that I do think could happen is you're not going to have to know the step-by-step of every area of menu planning, but here's what I would know for questions is where it starts and where it ends. Let's talk about the start. You start your menu by planning out your meats and other entrees for the entire menu cycle. This can be sometimes your most expensive food items, not all the time, but it is the area where you can have the most control over your food cost to a great extent. So if you started with your entree as a steak, you would want to ensure your other offerings there would be a chicken, a fish, a vegan vegetarian offering, maybe a stew or a meatloaf type of product. This is an area where you can choose your available options to those with religious or medical dietary restrictions too. Next, you'd want to pick a good starch item to pair with your entree. Traditionally, if you're serving meat, you would want to offer some type of starch, like a potato, and maybe a gravy with it. But you could also use an alternate starch, such as rice, pasta, whole grains as different substitutes for your starchy potato. As you're forming that starch option, of course, considering things like whether it's going to be raw, cooked, peeled, or served, making sure it's in different shapes, sizes, and colors and textures to allow some variety. Next, you'd look at your salad accompaniments, your appetizers, your sides, and then lastly, you would look at your desserts for the meal. And lastly, you have all of those menu items selected and organized. You just want to make sure that you would evaluate those government regulations and those managerial considerations that are met to make sure you haven't duplicated the menus in any way and that you are meeting the nutritional guidelines to keep your customers nice and satisfied. Now, to close out here before our questions, we're going to talk through emergency menu planning. What I would include here is that many operations have to have an emergency preparedness menu, especially hospitals and large food service operations. With emergency menu planning, what you're doing is you're organizing a menu that you can fall back on should there be a disaster, terrorist attack, or emergency situation. Now, this is typically used in healthcare organizations, like I said, but not exclusively. When we're going through this, we want to be able to address a variety of emergency situations. And that could be a power failure if you're going to have a large decrease in labor to a winter storm. But even something that could happen like if your whole labor force is going on strike, that could be an example of emergency preparedness for that menu too. You may have types of menus that would be focused on minimal staffing. Maybe you only have 25% or less of your staff. And maybe you would have a situation where you have a little bit more staff, but limited amounts of supply shortage here. In either case, you might be requiring to use many types of frozen foods, pre-packaged items that you're pulling out of the freezer. Maybe you would end up relying on using paper or plastic products instead of using your normal china that you use. Bagged salads, frozen items, bottled water, things like that would all be things that you would use to build into that menu and have that nice and implemented there. Now that you've all sat through all of our menu planning, let's apply this to some practice questions together. Menu planning for your food service operation should always start by planning out the entrees, primarily because A, they are the cheapest menu items, B, they allow the greatest control in total food cost, C, they require the highest amount of labor cost, or D, they are always the most popular. Menu planning for your food service operation should always start by planning out the entrees primarily because A, B, C, or D. Let's use process of elimination to help us out here. For A, they are the cheapest menu items. Well, that's definitely not right. I feel like they tend to be the most expensive items, actually. So I would say let's remove answer A, and I think you would all agree with me there. B, they allow for the greatest control in total food cost. I feel that's a true statement. That's really where it all starts, and I think this would allow for the greatest control in total food cost right there. I'm going to put a check mark by B. C, they require the highest amount of labor cost. Maybe. I'll put a little question mark by that. Possibly, but maybe not exclusively. D, they are always the most popular. Well, that sounds like a generalization. I don't think they would always be the most popular. They're generally popular, but maybe not always. I would get rid of D. So we're between answer B and C. They allow for the greatest control in food cost, or they require the highest amount of labor cost. If I'm stuck between this, I'm going to choose answer B, that menu planning for your food service operation should always start by planning out the entrees, primarily because they allow for the greatest control in food cost. Number 2, which of the following meals follows proper menu planning principles? A, meatballs, grape tomatoes, Brussels sprouts, and lychees. B, grilled tilapia, white rice, roasted cauliflower, and vanilla ice cream. C, tofu, carrot puree, hummus, and creme brulee. Or D, lamb, sauteed broccolini, rice, and sorbet. Which of the following follows proper menu planning principles? Let's start with A. Meatballs, grape tomatoes, Brussels sprouts, and lychees. What do you notice about all those foods? I notice they're all kind of round, right? So when I picture it on a plate, I go, they're all kind of round a little bit. I don't think this would be appropriate menu planning principles. I would get rid of A because they're all too round. B. Grilled tilapia, white rice, roasted cauliflower, and vanilla ice cream. It's a bit of a pale meal, I notice here, and I think we would need to have some more color in there, so I would get rid of answer B as well. It's too white. C. Tofu, carrot puree, hummus, and creme brulee. Well, we're getting some color in there, which is nice, but I would say the texture is maybe a little left to be desired because all those foods are just a little bit squishy to me, and I don't think C would be a good fit either. D. Lamb, sauteed broccolini, rice, and sorbet. Of my four options, I would say this is the best fit because it's offering many different textures, colors, and flavors within the food. So D would be my best fit for following proper menu planning principles for number 2. Number 3, cycle menus are best used for which of the following types of operations? A. Fine dining restaurants. B. Hospitals employing staff with low skill level. C. Bakeries and coffee shops. Or D. Schools and universities. Cycle menus are best used for which of the following? Starting with A. Fine dining restaurants? Well, I don't think I would want that for a fine dining restaurant because, again, a fine dining restaurant should have more of a static menu. They're meant to be very good at a few particular things. And so with that, if we had a cycle menu or new things offered every day, that might be really difficult for a fine dining restaurant to keep up with. I would get rid of answer A. B. Hospitals employing staff with low skill levels. Well, the trouble with that is if they have low skill levels, are they going to be able to handle the day-to-day changes in the menu? Maybe I'll put a little question mark by that there. C. Bakeries and coffee shops. I don't think they have a need for cycle menus because they're generally offering very specific type of items like baked goods, coffee shops. You don't need to cycle that in every single day. I would get rid of C. Or D. Schools and universities. Well, of my four options, I think D would be my best fit. Schools and universities, they're serving people every day, sometimes the same people every day, and a cycle menu should be the best fit for a school and university. I'm going to choose answer D for number 3. That wraps up today's lesson, students. I hope you watched, listened, learned, and enjoyed today's show. Remember, passing this exam is a journey. We all need assistance along the way. Do me a favor, hit that subscribe button if you haven't. Tell other studying students, rate, review, spread the word. Follow me on TikTok, on YouTube, on Instagram at RD Exam Ready. And as always, remember, happy studying to you, RD to be.